In my years of practice, the liver is one of the most resilient organs in the human body. And that resilience is exactly what makes liver disease so dangerous to catch late. Right now, your liver is performing over 500 distinct functions, filtering toxins, producing bile, regulating blood sugar, storing vitamins, making clotting factors. Most people don't think about their liver until something is very wrong. The problem? The liver has no pain receptors. It cannot signal distress directly. By the time obvious symptoms appear, significant damage has often already occurred. Today, I want to walk you through the 5 warning signs your liver may already be struggling. Signs that are easy to miss, easy to explain away, and critically important to catch early. These aren't vague complaints. They're specific, measurable changes that, when recognized, can make all the difference. The liver doesn't whisper, it sends signals. But too often, we dismiss them as just part of getting older. Let's change that. The liver's ability to regenerate itself is nothing short of remarkable. Yet this very trait can mask underlying issues for years. Unlike other organs, it compensates silently, continuing its functions even when compromised. Early warning signs often manifest subtly. Unexplained fatigue that persists despite rest, a yellowish tint to the skin or eyes, jaundice, dark urine, or swelling in the abdomen and legs. Even persistent itching without a rash can be a clue. These symptoms are frequently mistaken for stress, aging, or unrelated conditions. Another key indicator is changes in digestion, nausea, loss of appetite, or difficulty tolerating fatty foods. Blood tests revealing elevated liver enzymes or abnormal protein levels often confirm suspicions before physical symptoms worsen. Lifestyle factors such as excessive alcohol consumption, obesity, or exposure to toxins significantly increase the risk of liver damage. Early intervention through diet, exercise, and medical care can halt or even reverse progression. Awareness is crucial. Recognizing these signs and acting promptly can save not just your liver, but your life. The liver may not cry out in pain, but it speaks through these signals. Listen closely. The liver is nothing short of a marvel when it comes to its daily tasks. It's a multitasking powerhouse, filtering roughly 1.5 liters of blood every single minute. Think of it as your body's chemical processing plant. It produces bile, which is essential for breaking down fats in the food you eat. It also converts ammonia, a toxic byproduct of metabolism, into urea, which your kidneys can safely eliminate. Another critical role is storing glycogen, the liver's way of keeping a reserve of glucose ready for when your body needs an energy boost. On top of all this, it synthesizes albumin, a protein that helps maintain blood volume and produces clotting factors that stop you from bleeding excessively. The problem is, when the liver is overwhelmed or damaged, these functions start to decline, often silently. For many people, this can go on for years without any noticeable changes in blood tests or outward symptoms. But too often we dismiss them as just part of getting older. Let's change that. As we age, particularly after 50, our liver undergoes significant changes that can impact its ability to function optimally. One of the most notable shifts may be a reduction in blood flow to the liver, which some estimates put at roughly 40%, though this can vary. This diminished blood flow, combined with a reduction in liver volume, means the organ becomes less efficient at metabolizing medications and processing fats. Over time, decades of exposure to alcohol, medications like acetaminophen and NSAIDs, processed foods, and metabolic stress accumulate, further straining the liver. Non-alcoholic fatty liver disease, or NA-FLD, is now a leading concern for adults over 50 who don't drink. It affects up to 1 in 4 people globally and is closely linked to metabolic syndrome. The liver's resilience often masks these changes, allowing damage to progress silently for years. Symptoms like fatigue, skin changes, or digestive issues may emerge, but too often we dismiss them as just part of getting older. Let's change that. Beyond structural changes, aging also weakens the liver's regenerative capacity. Stem cell activity slows, and telomeres protective caps on DNA shorten with each cell division, accelerating cellular aging. Emerging research highlights the role of mitochondrial dysfunction in older livers, reducing energy production needed for detoxification. Environmental toxins, from pesticides to air pollutants, place additional strain on an already declining system. Interestingly, gut health plays a critical role. Leaky gut syndrome allows harmful bacteria and endotoxins to reach the liver via the portal vein, triggering inflammation. While genetics influence susceptibility, lifestyle interventions like intermittent fasting and targeted nutrients, e.g., NAC, milk thistle, show promise in supporting liver resilience. Early detection through advanced imaging and biomarkers, rather than routine blood tests, could revolutionize proactive care for aging livers. Fatigue is something many of us experience, especially as we age. But when your liver is struggling, the fatigue feels different. It's deeper, more persistent, and doesn't go away with rest. In my years of practice, I've seen how often this type of exhaustion gets brushed off as just part of getting older. But here's what's happening. Your liver plays a critical role in energy production. It converts stored glycogen into glucose, a primary fuel source for your body. When liver function declines, this process becomes less efficient, leaving you feeling drained. Another factor is toxin buildup. The liver is responsible for filtering harmful substances from your blood. When it's compromised, these toxins can accumulate, affecting your energy metabolism. You might notice brain fog or difficulty concentrating, even after a full night's sleep. Additionally, the liver produces albumin, a protein that helps maintain blood volume. Low albumin levels mean less oxygen reaches your muscles, contributing to that persistent weakness. This isn't the kind of tiredness you can fix with a nap or a cup of coffee. It's a bone-deep fatigue that lingers, often accompanied by a lack of motivation or mental clarity. If you're experiencing this, it's worth paying attention to, especially if it's paired with other symptoms like changes in your skin or digestion. Symptoms like fatigue, skin changes, or digestive issues may emerge, but too often we dismiss them as just part of getting older. Let's change that. Always check with your doctor to explore what might be behind these feelings. Let's talk about changes in the skin and eyes, subtle but critical signs that your liver might be under stress. One common indicator is jaundice, a yellowing of the skin and the whites of the eyes. This happens when bilirubin, a waste product the liver usually processes, builds up in the bloodstream. Even a mild yellow tint deserves attention. Another sign is persistent itching, often caused by bile salts accumulating under the skin when bile flow is impaired. Many people mistake this for a skin condition and treat it for months without considering the liver. Then there are spider angiomas, small spider-like clusters of blood vessels near the skin surface, often on the upper body. These can appear when estrogen metabolism is disrupted due to liver dysfunction. What makes these signs tricky is how easily they're dismissed. People often attribute jaundice to diet, itching to dry skin, or spider angiomas to aging. But these changes are your body's way of signaling that something deeper may be going on. Always check with your doctor to explore what might be behind these symptoms. One of the most concerning signs of liver trouble is swelling in the abdomen, what we call ascites. In my practice, I've seen patients dismiss this for months as simple bloating or weight gain, when in reality, it's often the liver signaling distress. Here's what happens. When liver tissue becomes damaged or scarred, blood flow through the portal vein, the major vessel carrying blood to the liver, faces increased resistance. This creates portal hypertension, a buildup of pressure that forces fluid out of blood vessels and into the abdominal cavity. Early on, you might notice your clothes feeling tighter around the waist without actual weight gain, a persistent sense of heaviness or discomfort when bending forward. Some describe it as a dull, constant pressure, not sharp pain, but an awareness that something isn't right. Another clue is swelling in the ankles and feet, which ties back to the liver's declining ability to produce albumin, the protein that helps retain fluid in blood vessels. Without enough albumin, fluid leaks into surrounding tissues. In my practice, I often hear people rationalize these changes as normal aging or too much salt, but they may signal something deeper. Always check with your doctor to explore what might be behind these symptoms. When the liver isn't functioning properly, one of the most overlooked warning signs involves changes in digestion and appetite. The liver produces bile, a crucial substance that helps break down fats in the food we eat. When bile production is impaired, digestion becomes less efficient, and this can manifest in several specific ways. For instance, stools may appear pale or clay-colored because bile gives stool its characteristic brown hue. Without enough bile, this color change can occur. Another sign is dark amber urine, which happens when bilirubin, a substance usually processed by the liver, is excreted through the urine instead of bile. Nausea, especially after eating fatty meals, is another common symptom. The liver's inability to handle fats properly can leave you feeling queasy or uncomfortable after meals that are rich in fat. Additionally, many people experience a loss of appetite, particularly for heavier fatty foods, as the body struggles to process them. Unexplained weight loss can also occur, even if you're not actively trying to lose weight, because your body isn't absorbing nutrients as effectively as it should. What worries me most is how often people rationalize these changes. I'm just getting older, or I must be eating too much salt. But these shifts are your body's way of signaling that something deeper may be going on. Always check with your doctor to explore what might be behind these symptoms. When the liver begins to decline, one of the most telling signs is a change in how your body handles bleeding and bruising. The liver is responsible for producing clotting factors, proteins that help your blood clot effectively. When liver function diminishes, the production of these clotting factors drops, and your blood takes longer to clot. This can lead to practical, everyday signs that are easy to overlook. You might notice bruising easily from minor bumps, even when you don't remember hitting anything. Small cuts or wounds may bleed longer than usual, and nosebleeds can become harder to stop. Additionally, the liver plays a role in platelet function, which further impacts how your blood clots. What worries me most is how often people rationalize these changes. I'm just getting older, or I must be eating too much salt. But these shifts are your body's way of signaling that something deeper may be going on. Always check with your doctor to explore what might be behind these symptoms. Liver function tests can be among the most misunderstood tools, and many people assume normal results always rule out liver problems. Let's break them down simply. Alt-alanine aminotransferase is an enzyme primarily found in the liver. When liver cells are damaged, ALT leaks into the bloodstream, so elevated levels often suggest liver stress. AST-aspartate aminotransferase is less specific, found in the liver, heart, and muscles. A high AST with high ALT points to liver issues, but AST alone could reflect other conditions. Alpha-alkaline phosphatase rises when bile flow is blocked, common in bile duct problems or gallstones. GGT gamma-glutamyl transferase is another marker of bile flow issues, often elevated with alcohol-related liver changes. Here's the critical point. Normal LFTs don't guarantee a healthy liver. The liver can lose up to 70% of its function before enzymes rise noticeably. Early fatty liver or fibrosis often flies under the radar because the liver compensates so well. That's why I tell patients not to rely solely on these tests if they're experiencing symptoms. A liver ultrasound can reveal fat accumulation or structural changes long before blood tests shift, and the FIB-4 score calculated from age, platelet count, ALT, and AST helps estimate fibrosis risk even when individual values appear normal. What worries me most is how often people rationalize these changes. I'm just getting older, or I must be eating too much salt. But these shifts are your body's way of signaling that something deeper may be going on. Always check with your doctor to explore what might be behind these symptoms. What worries me most is how often people rationalize these changes. I'm just getting older, or I must be eating too much salt. But these shifts are your body's way of signaling that something deeper may be going on. Always check with your doctor to explore what might be behind these symptoms. One of the most accessible tools for investigating liver health is a liver ultrasound. This non-invasive imaging technique allows doctors to detect fatty liver, enlargement, or structural changes in the liver. It's widely available, painless, and doesn't involve radiation, making it a safe first step in screening. In many cases, an ultrasound can reveal abnormalities before blood tests show any significant changes. For example, it can identify fat accumulation in the liver, which is a common early sign of non-alcoholic fatty liver disease, NAFLD. It can also detect changes in liver texture or size, which may suggest fibrosis or other issues. Importantly, an ultrasound is just one piece of the puzzle. It's often used alongside blood tests and clinical evaluation to get a clearer picture. If you're noticing any of the signs we've discussed, or if you have risk factors like diabetes, obesity, or a history of medication use, consider asking your doctor about whether a liver ultrasound might be helpful. Early detection can make all the difference. Remember, your liver is remarkably resilient, but it needs your attention, especially as you age. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. A tool called the FIB-4 score may be used in some liver health screening settings. In my practice, I find many patients haven't heard of this simple calculation that can provide early clues about liver fibrosis risk. Here's how it works. We take 4 routine measurements from your blood work, your age, ALT and AST enzyme levels, and platelet count, and plug them into a specific formula. What emerges is a number that helps estimate whether there might be underlying liver scarring developing. What makes this so useful is that it uses data you likely already have from standard lab tests, requiring no additional needles or costs. A score below 1, 3 generally suggests low risk, while above 2, 67 may indicate the need for further evaluation. But here's the crucial detail many miss. This isn't a standalone diagnosis. I've seen patients become unnecessarily alarmed by an isolated high FIB-4 score when other indicators were normal. The real power comes from tracking this number over time, alongside other tests like ultrasound. For those over 50, I particularly appreciate how this score accounts for age, recognizing that liver tissue changes naturally over decades. If your recent blood work includes platelets and liver enzymes, ask your doctor to calculate your FIB4 score at your next visit. It's one more piece of the puzzle in understanding your liver's health trajectory. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. In my years of practice, I've seen how alcohol impacts the liver, especially as we age. After 50, the liver's ability to process alcohol slows significantly. Even moderate drinking can place a heavier burden on this vital organ. Alcohol is metabolized in the liver, and when consumed in excess, it can lead to inflammation, fatty liver, and, over time, more severe conditions like cirrhosis. What's often misunderstood is that moderate drinking guidelines don't account for individual differences in liver health, age, or medication use. For many people, reducing alcohol intake or eliminating it altogether can make a profound difference in protecting liver function. It's also important to remember that alcohol isn't the only factor. Combining alcohol with medications like acetaminophen or NSAIDs can amplify liver stress. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. Beyond alcohol, there are several lesser-known factors that can significantly affect liver health. Environmental toxins such as pesticides, heavy metals, and industrial chemicals can accumulate in the liver over time, impairing its function. Processed foods high in trans fats, refined sugars, and artificial additives also strain the liver, as it works tirelessly to detoxify these substances. Viral infections like hepatitis B and C remain major culprits in liver damage, often going unnoticed until significant harm has occurred. Additionally, sedentary lifestyles and obesity contribute to non-alcoholic fatty liver disease, NAFLD, a growing concern worldwide. Emerging research highlights the role of gut health in liver function, as an imbalanced microbiome can lead to inflammation and liver stress. Stress itself, often overlooked, triggers the release of hormones that can indirectly harm the liver. Awareness of these factors, coupled with lifestyle adjustments, can play a crucial role in maintaining liver health. Regular checkups, a balanced diet, and minimizing exposure to harmful substances are essential steps in safeguarding this vital organ. Managing blood sugar and insulin resistance is one of the most effective ways to protect your liver health, especially when it comes to preventing the progression of non-alcoholic fatty liver disease, or NAFL. Insulin resistance occurs when your body's cells don't respond properly to insulin, leading to higher levels of sugar in the blood. Over time, this excess sugar is stored as fat in the liver, which can lead to inflammation and damage. NAFLD is strongly linked to metabolic syndrome, a cluster of conditions that includes high blood sugar, high blood pressure, and excess body fat around the waist. In fact, NAFLD is now the leading cause of liver disease in adults over 50 who don't drink alcohol. The good news? Small, consistent changes can make a significant difference. Regular physical activity, even without significant weight loss, has been shown to reduce liver fat. A diet focused on whole, unprocessed foods, rich in fiber, lean proteins, and healthy fats can help stabilize blood sugar levels. Limiting refined sugars and carbohydrates is also key, as these can spike insulin levels and contribute to fat accumulation in the liver. For those with prediabetes or diabetes, working closely with your doctor to manage your condition is crucial. Medications like metformin, when prescribed, can help improve insulin sensitivity and protect liver health. Remember, the liver is incredibly resilient, but it needs your support to function optimally. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. In my years of practice, I've seen firsthand how medications like acetaminophen and NSAIDs, while incredibly useful, can pose risks when not used carefully. These medications are metabolized by the liver, and exceeding recommended doses can overwhelm its capacity to process them safely. For acetaminophen, the daily limit for most adults is commonly cited as 4,000 milligrams, though many people may unknowingly take more when using multiple over-the-counter products. Similarly, NSAIDs, while effective for pain and inflammation, can strain the liver, especially when used regularly or in higher doses. After 50, the liver's ability to metabolize these medications slows, making adherence to recommended doses even more critical. If you take these medications often, it may be wise to review their use with your doctor. Remember, small adjustments in medication use can make a significant difference in protecting your liver health. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. Regular physical activity plays a crucial role in maintaining liver health, even when significant weight loss isn't achieved. Exercise helps reduce liver fat by improving insulin sensitivity and promoting better metabolic function. For many people, regular moderate activities such as brisk walking, swimming, or cycling most days of the week may make a meaningful difference. Studies show that consistent movement helps lower liver enzyme levels and decreases inflammation, even without dramatic changes on the scale. It's not about intensity or duration as much as it is about consistency. Gentle, sustained activity can be just as effective as vigorous workouts for liver health, especially for those over 50. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. Incorporating mindfulness practices alongside physical activity can further enhance liver health. Techniques like meditation and deep breathing reduce stress, which is known to negatively impact liver function. Chronic stress can elevate cortisol levels, leading to increased fat storage in the liver. By managing stress through mindfulness, individuals can support their liver's ability to metabolize fats and toxins more efficiently. Additionally, hydration plays a pivotal role in liver health. Drinking adequate water helps flush out toxins and ensures optimal liver performance. Pairing hydration with a balanced diet rich in antioxidants, such as leafy greens and berries, can amplify the benefits of exercise. Sleep is another often overlooked factor. Quality rest allows the liver to repair and regenerate. Combining these habits, mindfulness, hydration, nutrition, and sleep with regular physical activity, creates a holistic approach to liver care, fostering long-term wellness without relying solely on weight loss. When it comes to liver health, supplements are often marketed as quick fixes, but caution is essential. Many over-the-counter liver supplements claim to detoxify or repair the liver. But in my years of practice, I've found that these claims are rarely backed by robust scientific evidence. Some supplements can even cause harm, leading to liver injury or interfering with medications you may already be taking. For example, certain herbal remedies and high doses of vitamins like vitamin A or iron can strain the liver rather than support it. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Share this information with someone who might benefit from it. While diet and lifestyle play a far greater role in liver health than supplements, emerging research highlights specific nutrients that may offer genuine support. Studies suggest that compounds like milk thistle, silymarin, and N-acetylcysteine (NAC) show promise in reducing liver inflammation, particularly in cases of fatty liver disease. However, their efficacy varies based on individual health conditions and dosage. Unlike unregulated supplements, clinically studied formulations under medical supervision, such as prescribed vitamin E for non-alcoholic steatohepatitis (NASH), demonstrate clearer benefits. Crucially, hydration, fiber-rich diets, and limiting alcohol remain foundational. New findings also emphasize the gut-liver axis, where probiotics and polyphenols from foods like coffee and berries may indirectly aid liver function by improving gut microbiota. It is often wise to prioritize evidence-based approaches over marketing claims. The liver is truly one of the most remarkable organs in the human body, with an incredible capacity to regenerate itself when given the chance. This regenerative potential underscores the importance of early detection and intervention. When liver damage is caught early and the underlying cause is addressed, the liver can often heal and recover significantly. However, the key is to act promptly and not dismiss subtle warning signs as mere aging or fatigue. If you or someone you know is experiencing any of the symptoms we've discussed today, it's crucial to consult a healthcare professional. Always work with your own doctor to explore any concerns and take proactive steps to protect your health. Early action can make a profound difference. Share this information with someone who might benefit from it, because awareness is the first step toward prevention and care. Remember, your liver's resilience is its strength, but it's up to us to give it the support it needs to thrive. Beyond its regenerative abilities, the liver plays a vital role in detoxification, metabolizing nutrients, and producing essential proteins like albumin and clotting factors. It also stores vitamins and minerals, releasing them as needed. Modern research highlights how lifestyle choices, such as diet, alcohol consumption, and medication use, directly impact liver health. Emerging studies suggest that even moderate alcohol intake or prolonged use of over-the-counter pain relievers can strain the liver over time. Conversely, hydration, balanced nutrition, and regular exercise promote optimal function. Non-alcoholic fatty liver disease, NAFLD, is now a growing concern, linked to sedentary habits and processed foods. Cutting-edge treatments, including targeted therapies and microbiome research, offer new hope for liver conditions. Yet, prevention remains paramount. Routine checkups, mindful habits, and avoiding toxins can safeguard this multitasking organ. Its silent workload often means damage goes unnoticed until advanced stages. So vigilance is key. Empower yourself with knowledge and prioritize liver health as part of